Hi, physiotherapists in the world seeking the best treatment for relieving pain. Thank you for watching my video. I am Shogo from JPR, Japan Pain Rehabilitation. I'd like to introduce you to our unique evaluation of facial release manipulation technique for pain release. Today, you will learn how to examine a patient diagnosed with rotator cuff injuries and find the muscle causes the problem. Yes, this muscle, rotator cuff muscle, do you know? In anatomy class, you have learned the rotator cuff is made up of four muscles: supraspinatus and infraspinatus and teres minor and no, this one and this muscle, subscapulars. Okay, these four muscles covering the humeral head to help move the stabilize the shoulder joint. And it is known the pain of rotator cuff injuries is caused by impingement. Among four muscles, supraspinatus used in elevation of arms is more likely damaged because it is pinched between the acromion and humeral head. Okay, yes, this area. Mm. Those who need to elevate their arm is activities or use hands at work can possibly have the injured supraspinatus muscle. Impingement occurs even by aging. During my school days, I read a report that from 20 to 30% of the seniors got damaged supraspinatus muscle. Do you know? Yeah. Because of anatomical structure, the supraspinatus muscle can receive stress and damage by repeated action and yeah. Where? Sorry, one more. Because of anatomical structure, the supraspinatus muscle can receive stress and damage by repeated action and overuse, which causes significant pain and disability in motion of the shoulder joint. After the distance between bones or the tear in the supraspinatus muscle checked by MRI or X-ray, the first thing for a physiotherapist to do must be to remove the pain from the shoulder by applying manipulation therapy. The reason why removing pain should be the first priority in the treatment is that pain in either rotator cuff injuries or frozen shoulders causes the defensive muscle contraction as a secondary result. Then the vicious cycle starts. Disease hardens the muscle, which limits the range of motion. Then disuse and hardened muscle give more pain and it gets worse and worse. Yes, worse and worse. The answer to get out of this cycle is not giving immediate muscle training for why widening the range of motion, but removing pain in the shoulder at first, which will also encourage patients to try exercise later on. To show you more clearly, here is here is a structure whose supraspinatus muscle is located in this area. Yes, this area. It runs from supraspinatus fossa to the humeral head and the part where the most damage occurs in here, in the biggest muscle bridge around the middle of supraspinatus fossa. How can we find the main muscle causing problems? It is simply and easy. First, keep pressing. Pressing the supraspinatus muscle. Ask the patient to elevate or rotate his or her arm. Then, if the patient feels less pain or can have better motion, we can tell the supraspinatus muscle is the cause of the damage and pain. Second, give treatment on the supraspinatus muscle to stop the vicious cycle. It is repeated contractions that make the supraspinatus muscle is mechanical stress, and you can see what will happen if the physio exercise give further contraction. Now, we realize every physiotherapist should know the way of muscle expansion as well. If muscle contraction occurs in exercise, what makes muscle expand? Expanding needs release such as our fascia release, which will remove most of the stress and keep the muscle neutral. Just check the supraspinatus muscle by pressing. If pain and immobilization has gone, not stretching but your manipulation technique can release the muscle. Okay, release the muscle, this muscle.
Supraspinatus.
Yes. So, what I told you today is to release the supraspinatus muscle of your patient with rotator cuff injuries. If you are a physiotherapist who doesn't have proper manipulation technique or can't decide which muscle to be treated, don't miss the chance to click below on the link to gain these skills. We share our useful information and technique with physiotherapists, judo therapists, doctors, and many more individuals in Japan, and you are welcome to join us. Thank you for watching and see you next time. Bye bye.